Today we are doing examinations across the nation with my special guest, John Kulikowski. First, we will begin with inspection of the head. We look around and ensure that the skull is intact, the nose is well straight without any afflictions or breakage. He is not bleeding, he is not hurt. We then begin with palpation. First, we check the hair to make sure that it is attached well and firmly. Look at that beautiful scalp. And then we palpate the sinuses to ensure that there is no pain. Are you experiencing any pain, sir?
No.
Good. Within feel of the neck, do you have any pain here in your neck?
No.
We then begin with the lymph nodes. We do a simple rolling motion with the fingers up and down until we get to the neck. We will check the mandibular and work our way up and back down the neck. Then, if you could swallow for me, we feel no thyroid, which is a normal finding. Next, we may test the visual acuity of the patient by using a pocket Snellen chart. Sir, if you could please cover your right eye and read the farthest line down that you can.
D-E-F-P-O-T-E-C.
As you can see, he's reading 20/20 right now. Now cover your other eye.
P-E-C-F-D.
As you can see, he's a little bit higher up on that one, but that is not detrimental to him. Next, we check the reactiveness of his eyes and retina by using a light. We'll first look at his eye. If you can look up at that wall over there. We'll look at his eye and see if it is reactive. We'll first look at this eye if it is reactive, and then see if the adjacent one is also reactive in turn. And then continue to the other eye. They are both equal and reactive, which is very normal. Next, we shall inspect the inside of the retina by using the ophthalmoscope in its proper use. We use the right eye and looking at his right eye as well, and then the left eye and looking at his left eye. If you could look over at that point again, we will begin to inspect his eye. We first check for red reflex, and then slowly focus in to see the veins and structures of the retina and the inside of the eye. Of course, it's a little bright, you might be a little bit blinded. And then you will proceed to the other eye and do the same thing using the left eye. Very good. His structures are normal, and he has no retina problems. Next, we will check his peripheral field vision and to check his nystagmus movement. First, we'll ask him to focus on the point of the finger. And then we will move left, right, and down. And then continue up, left, you gotta follow it, there you go. And down, follow it, there you go. Good. This checks the eye movement. Now I'm going to ask him to focus on a point. Look at my eye, and I will close my eye, and you close your eye. Then I will ask you to tell me how many numbers am I holding up?
3.
Okay, you got to focus on me.
Okay.
How many numbers am I holding up now?
Quick.
Okay. Now close your other eye. There you go. How many numbers am I holding up?
4.
Good. How about now?
4.
Good. There we go. This concludes the visual exam. Now we move on to the ears. Next we will look inside the ear with the otoscope. We will hold the pin up back and look inside. This might be uncomfortable for the patient. Looking inside the ear, we will see cerumen and wax. But that is a normal finding, as well as a pearly gray eardrum. This is a normal finding. Now we look on to the other eye. Ear. Looking inside, we also see ceruminous fluid and a pearly gray eardrum. This is a normal finding once again. Finally, we will do the Weber test to determine his hearing. Can you hear it on both sides?
Yes.
Equally?
Yes.
Very good. Now, if I had an actual tuning fork, we could perform the Rhine test as well by placing it behind the patient's ear and listening. But of course, this is just a phone, unfortunately. This concludes our examination. Thank you very much for attending.